Welcome to the Functional Medicine Foundation's podcast, where we explore root cause medicine, engage in conversation with functional and integrative medicine experts, and build community with like-minded health seekers. I'm your host, Amber Warren. Let's dig deeper.
So part of what I enjoy so much doing with these men is to get them fully functioning again.
Yeah.
So they're a team, a part of a unit, a cohesive family again, where they don't feel down, depressed, irritable, marginalized. And guess what? Their kids, their boys, and their daughters are going to see that, and I think they're going to be better for it.
Absolutely.
Otherwise, it just gets kind of distilled down to, what are we trying to do here? Just create these, oversexed, muscular guys that aren't really contributing much to society. It's just such more, it's such a bigger topic.
So much bigger than that,
And I think it's important to have this conversation talking about the men's side specifically, because there's two genders listening to this audience, and there's always that group that says, I don't want my husband to, become a jerk or lose his temper or treat the kids poorly or treat me poorly because he's on this stuff.
Oh, I think it's the opposite, though.
It is the opposite in my experience.
Yeah,
and
too.
The data is very clear. Most guys that are hypogonadal are the ones that are having mood issues,
100%.
and not just depression, but they're curmudgeons. If they're older, they're just a pain to live with. And even the younger ones can just be really not a party either.
Totally.
So there is a sweet spot there, and it's not just about giving super physiologic doses. You asked a question about peptides, and so the guys that don't need to lose 20, 30 pounds, where we're going to be using a GLP instead, we use these growth hormone secretagogues, which it's not growth hormone itself, which is therein lies the beauty. It's basically a naturally occurring peptide that's been created in a compounding pharmacy to be taken at night, 90 minutes or so after your last meal, and it tells the hypothalamus, the brain, hey, let's make some growth hormone. And then there's another one that you give with it that says, let's let it out. Let's release it, as opposed to giving growth hormone itself, which downregulates receptors and can have some dangerous side effects. So what is growth hormone? Why would we ever want to support that? Well, it's secreted during deep sleep at night. And if anyone's worn an Oura ring or a smartwatch and looked at their Fitbits, their wearables, and seen how crappy their sleep can be when they've had a lot of stress or whatever,
or 1 or 2 drinks of alcohol,
or that can mess it up too.
Toxic
can raise
cortisol.
Social, you come to the conclusion that there's a lot of disruption, not only to growth hormone, which gets dosed every night. That's when it's repairing all your tissues from the damage the day before.
And we lose growth hormone as we age. So that's also why this is important.
Yeah, it's a slow road down as well for both men and women, along with testosterone. So those are your two anabolic building hormones that we're losing as we age. Women are largely using estrogen as well for muscle, but it's so important to understand that if you're giving something that's supporting growth hormone along with optimizing T, it's a fat burner, basically. It helps burn fat while protecting your structural protein, i.e. lean muscle mass. So if you can look at a guy who's within 10 pounds of where he wants to be, he's got pretty good body composition on the measurements that we do, percent body fat, percent lean, and he's really just wanting to get some of the tummy fat off, wants to lean out a little bit more. Those growth hormone secretagogues are releasing peptides are amazing to do that. In addition, sometimes synergistically with optimizing T.
Love it. Yeah,
and that's how those hormones were meant to work together.
Absolutely.
So if they're both declining as you age, and you can get somebody on something like that in a pulsed fashion, it can be really helpful.
Yeah,
and it's not a forever thing like the T. We use these things for 2-3 months at a time, and then take a month or two off, and maybe that's all they needed to get the ball rolling.
Right.
You know?
And similar to testosterone, I'm blown away how many people are like, oh, my deep sleep is so much better, which impacts their whole day.
Yeah. Isn't that interesting how structural anabolic hormones help sleep?
Yeah.
They're regenerative for our tissues.
Right.
Evidently, they're doing more.
It's amazing.
And there's a whole topic about melatonin and why it's high at night and its antioxidant job in the mitochondria, which is ironically where hormones are made.
Made in the mitochondria.
Yeah.
Are you looking for high-quality supplements? FunMedShop.com is carefully curated by the wellness experts at Functional Medicine of Idaho. You'll find high-quality supplements to support your health and optimize your body's natural functions. Rooted in responsible sourcing and utmost commitment to purity ensures that you're getting products that are not only effective, but also safe and reliable. Plus, you'll find our own line, Functional Medicine Foundations, which is carefully formulated using the best ingredients available so you can trust that you're giving the body the support it needs. Visit funmedshop.com today and take the next step in your health journey. That's funmedshop.com. So part 2 of this is, what do we do about this, the lack thereof testosterone optimization or subpar testosterone? So lots of different ways we can replace these guys.
Yeah.
So tell us the different ways.
Yeah, weight loss. It's that same list. It's literally not just weight loss, but losing body fat.
Yep.
The data is really clear on whether you look at pre-diabetic data or diabetic data. You lose weight. That's great. But if you lose body fat, both sub-Q and particularly visceral fat, that's probably the number one way you can naturally raise your T.
Cool.
Number 2 would be exercise. Number 3 is going to be right in there. Close third is that diet that we talked about, which is avoiding those processed foods and spiking your sugar. And then lastly would be getting good sleep and managing that cortisol.
Okay.
If you get less than 5 hours a night of sleep for more than a week, guys, there's a JAMA study, 2011, dropped their T by as much as 15%.
Wow.
So glad we didn't know that in school, right?
Yeah.
I don't know that I got 5 hours sleep for 4 years in med school.
Yeah, your levels dropped quite a bit.
Honestly.
It's good you know what you know now.
Right?
So for those guys who are saying, yeah, doc, I've checked those boxes, or I'm working on it, I'm getting there, but my levels are still 300 and I feel like garbage.
Yeah.
Then how do you choose who to replace and how you replace them?
Yeah. So then it's a matter of choosing them. Are they a good candidate? Basically, the hard contraindications are breast cancer or active prostate cancer. We do treat guys with low stage and grade prostate cancer when we're co-managing with urology now all the time. If they have obvious symptoms, if their PSAs aren't stable or there's something changing on their PSMA PET scans or their MRIs, then you got to hold off. You got to have stable prostate cancer before you can treat them. Okay. Breast cancer, certainly a hard no. If they haven't had a heart attack or stroke in the previous 6 months, they don't have an active clot. History of a clot is a relative contraindication. I don't use that as a hard no.
Okay.
It is for estrogen, but not for T. And they've got symptoms, that list of symptoms, whether they're mental, physical, sexual, metabolic, abnormal labs, fatty liver. So safe, they've got symptoms. And then you look at their physical exam, do they have a lot of belly fat? Do they have the acanthosis nigricans, which is the pigmented, hyperpigmented creases on the skin in pre-diabetics? Do they have evidence of high cholesterol on their eye exams and on their labs? So you're looking for signs, physical signs. Do they have changes? Do they have increased breast growth? You see all these guys that have breasts that are growing, and it's like, what's going on there? They got way too much estrogen. You feel and check their testicular size. Sometimes there's problems there. They're soft, kind of squishy and not firm, normal testicle. There can be problems, not just from infections and mumps in the past, but there's all kinds of other things that could be going on with them, with toxins. Do they have a history of undescended testicles? Or is there a problem with toxic burden. What's their job? Are they a firefighter?
Yeah.
Are they a farmer? Are they,
Or where did they grow up?
Where did they grow up? Where, a downwinder? Are they getting their water from a well? It's, full of phthalates, which we know does a number on your in utero and ex utero levels of T. Do they drink out of plastic water bottles or getting a bunch of BPA, handling receipts, where we get those things. These are all known endocrine disruptors. So, you ask all these things in this history. It's quite an elaborate history.
Yes, it is.
You got to go through mood and everything. Physical exam. So they're a good candidate. You're going to obviously then look at labs.
Yep.
And I usually look at total and free testosterone the first time. And if it's abnormal, we know we're going to have to repeat it. So as long as it's on a separate day and they're not acutely ill with some illness, you bring them in, ideally fasting before 10 a.m. You check a second one. And on that second round, I'm going to add, probably PSA if they're older. I'm going to check estrogen. I'm going to check LH, FSH, blood counts, liver. I'm going to basically want to know, okay, it's not only confirmed now, but are they safe to treat? And are they primary or are they a secondary hypogonadal? And that's what all those other tests help me know. And then you decide with them, okay, you're a good candidate. You've got symptoms. Your labs are there or not. Sometimes, again, it's optimizing and the labs are more irrelevant. But there are certain things you have to make sure on the labs that aren't contraindications. Do you have a wonky PSA? If so, you're probably going to have to do a rectal exam or at least an ultrasound or MRI. Clear the prostate first. Make sure they don't have a nodule. And then you're going to talk about what the different modes of delivery are. Basically, you've got creams, gels, roll-ons, things that you can stick to your gum, which I don't recommend. Gum in your mouth, not chewing gum. Nasal sprays. More commonly the most common is gels and creams. Probably the most effective are the injection. And there's four different types that you can do there. And then pellets. The injections are the least expensive. They're more apt to give you a roller coaster on the dosing and side effects and needing to go donate blood. Because a lot of guys, when they do injections, they get a really big overshoot. And then their bone marrow makes too many red cells, which can thicken the blood, and you got to go donate blood, which we often will see that with the injectable more so than pelleting.
Pellets,
Pellets are every 6 months on guys, every 4 on the gals. Pellets are great. You put them in and you can kind of forget about it. If the dose didn't last or you didn't get the pop you wanted, you do a complementary booster at a month. And depending on the labs and their symptom relief, you make choices for the next pellet, what you're going to do. Usually by the first couple of times, they have a pretty good idea.
So advantages over pellets over like the injectable.
So it costs a little bit more.
Okay.
But the advantages of pellets, you don't have to give yourself a shot twice a week. You avoid a lot of the roller coaster. A lot of weightlifters prefer injectable over pellets because they feel like the pellets fade. That's because it was dosed improperly. And that's something that's easy to solve for by going up on the dose.
My other argument to that would be that testosterone is synthetic. It's actually testosterone cypionate.
Yes.
So it's not nearly as natural for those that are interested in that as like the pellet form would be.
Pellets come from ground up yam. And it's actually testosterone. The injectable cypionate is a synthetic prohormone, kind of like levothyroxine or Synthroid is for the thyroid. It's T4 that has to get converted to T3. Well, cypionate has to go from the shot where you gave it to your liver, get converted to testosterone before it can go and tag the receptors. So there's advantages on side effects, convenience. If cost is the only thing that they care about, injectable is probably going to be the way they go. If convenience, consistency of dosing, not having to hassle with going and donating blood, and not being as worried about some of the downstream metabolites are a concern, then pellets are probably the way to go. Creams and gels are, most guys, it's not what they enjoy doing.
It's just a pain.
Yeah.
Most of them you need to apply twice a day, right?
Yeah.
And
You got to wait.
What guys are going to do that?
Hours. Yeah. You got to wait 4 hours before you can take a bath, shower.
Well, and you don't want to get it on your wife or your kids or your pets.
You dose your pets, everybody, and you got to use your own hand towels and watch what you touch after. And yeah, it's really easy to contaminate people that don't want that testosterone. And that tends to be pretty pricey.
Yeah. Yeah, true.
The gels are all that you can get through regular pharmacies. They don't do creams. That's got to be through compounding. And compounding is much less expensive for testosterone topical than having to pay full price for Testim and Androgel. And the other thing I didn't mention is there are 3 FDA approved oral long-acting testosterones that are out there. And I've always been a little gun shy of those because of the history of that being absorbed through the liver and then creating problems in the liver. They have testosterone undecanoate, which is a long-acting ester of the testosterone, both in injectable and in oral forms now, that have gotten away from first-pass liver metabolism, meaning they don't get absorbed through the liver. They get absorbed through the lymphatic channels in your small intestine, bypassing the liver. They're new. They are associated with hypertension, albeit the studies are pretty minimal. I mean, it's like 2% or something, 2 to 5% that get actually a bump in blood pressure.
Okay.
But if you're part of that 5%, I'm just like, man, I don't need any help with battling high blood pressure.
Right.
With the bulk of majority of people having it in our culture as they get older. But that certainly that's an option.
Okay.
The problem is, again, to get that paid for, you have to qualify, meaning most of the guys that are here to optimize, they're going to end up coming out of pocket.
Levels,
It's going to be hundreds and hundreds of dollars a month to buy the oral version of T. So those are out there and available now.
Okay. So interesting.
Yeah.
So who's a good candidate?
Oh, man. So we don't want to give it to guys that are still wanting to have kids.
Right.
Because if you give testosterone to younger any guy, it'll shut down the ability to make sperm.
But we have options for those guys.
We do.
Right? We do.
Yeah.
If
We have options.
Still have low T and
there's prescription options for those guys where if you've got low T and you're symptomatic with Clomid and clomiphene now through the compounders, which has less estrogenic side effects, and HCG injections are out there and they work great.
Yeah.
If you're looking to get your numbers up around 800, anything above that, that's about where they peak out.
Okay.
You got to go to T.
Okay.
So if it's a guy that doesn't care about siring any kids in the near term, a question I get often is if I start testosterone at 35 and I get, God forbid, get remarried and my young thing wants to have a family in my second term, time around here, what about that? Well, you're able to stop that and things will come back online. The synthetics, don't hold your breath. It may not.
Yeah.
It can take months, and after pellets, it can take upwards of a year for the sperm counts to come back. But for everyone else, you can use testosterone and that client that's got those symptoms, whether it be metabolic dysfunction, whether it be sexual side effects, whether it be just, hey, I need more cognition. I want to get rid of my brain fog and improve my focus, my stamina, my recovery time. I want to build more muscle. I want to lose belly fat. We know testosterone is really good at helping you lose fat and gain muscle.
Yeah. Or you just don't want to follow in your father or grandfather's footsteps of having an MI at 60, right?
Exactly. We used to think it caused prostate cancer. Now we know that's not true. Dr. Huggins, 1941, won the Nobel Prize for doing a bogus study on dogs. 80 years later, we're finally finding that to not be true. And now we're realizing that it not only doesn't cause heart attacks and strokes like we thought, the FDA label hasn't even caught up yet. The new Traverse trial that was just released a year ago in July it's powered enough statistically to now show it doesn't cause heart disease, doesn't cause prostate cancer. And in fact, we think that it actually helps prevent heart attacks. Yeah. So amazing when you think about the number one cause of death in this country being cardiovascular disease.
We have tools, very safe and effective tools to decrease that statistic. Yeah, reduce that risk. It's amazing. Yeah. Anything else you find that is important or pertinent to share around this topic of male hormones and optimization?
I think you really did a good job, Amber, at kind of exposing the fallacy of thinking that it's one issue.
Yeah.
It is one hormone on a dance floor of dancers.
Yeah. Mm-hmm.
And if you don't pay attention to who else is out there, they can knock you over.
Right.
And you're spending money on these things, and you want them to be effective.
Right.
You may not need it.
Right.
There may be some of these other players that you can get to first.
Mm-hmm.
You may only need to work on weight loss.
Yeah.
And the right kind of exercise. Absolutely. And tweak your diet just a little bit and not need them.
It can be enough.
Might be all you need. I have seen guys raise their testosterone by 50%.
Wow.
Within 6 months with lifestyle changes, not touching a supplement.
And that's truly the beauty of functional integrated medicine and what we get to do every day, right? Is you can try A, B, and C first before you have to rely on D. Yeah. D is always an option, but we don't have to go there initially, especially if that's not your desire. Our job is to meet you where you want to be met and try and reach your health goals together. So it's wonderful. Well, men and women alike, we hope you share this with your brothers and your dads and your colleagues and coworkers. And because this is a message we definitely want out there. We talked in the female version about how no one should have to suffer in silence. And it's true for our guys too. So thank you, Dr. Holthouse. Thank you for those of you that tuned in.
Thank you. You're welcome.
Thank you for listening to the Functional Medicine Foundation's podcast. For more information on topics covered today, specialties available at the FMI Center for Optimal Health, and the highest quality of supplements and more, go to funmedfoundations.com.